As we flew into Port-au-Prince, we saw the result of deforestation, the dumping of rich topsoil into the ocean. Once fertile lands were left barren, no longer capable of supporting agriculture. As we left the airport, we saw the slums, steep hillsides overrun by 1- and 2-room huts with dirt floors that turn to mud whenever it rains. We saw tent cities and rubbish, dilapidated buildings and roads, polluted streams. But when we looked closer, we also saw unmistakable signs of hope. People smiling and laughing, nicely dressed men and women walking to and from work, playful school children in colorful uniforms, a vibrant informal economy of street vendors. The dirt road to Cherident is long and rutted. Upon arrival, you notice corn and other crops growing along the roadside, people out visiting one another, men playing soccer on a distant field, goats, wild turkeys, and roosters. And you notice Clinique Jean Wilfrid Albert. It is a beacon of hope in a country that on the surface appears hopeless. Since it opened in 2006, 8,700 patients have received care for malnutrition, hypertension, and a range of infectious diseases. Due to the remoteness of the region, almost all of these patients otherwise would not have found medical treatment. In many cases, without our clinic, they would have died. Dr. Catalin is our physician. Since his arrival in 2009, the number of new patients at the clinic has tripled. Many, including pregnant women and mothers carrying children, walk hours in search of his care. As approximately half of our patients are women and children, maternal care is afforded a high priority. As an example, upon learning of a woman who had been laboring in childbirth for 3 days, Dr. Catalin made his way to her home and after 6 difficult hours, delivered a healthy baby girl. Once mothers stop nursing, malnutrition becomes a major problem for their infants. Medica Mamba, which means peanut butter food in Creole, is a nutritional supplement that has been used with great success to treat underweight children. This year, 80 have been treated and 27 have reached their normal weight and no longer require the supplement. Nearly 1/4 of the cases at the clinic are the result of gastrointestinal and parasitological diseases. One young mother was severely ill and unable to speak following extreme dehydration. After several days at the clinic, she was fully restored to health. As in most parts of Haiti, the leading causes of illness and death are common ailments such as hypertension, anemia, and infectious diseases. Many of these conditions can be prevented, cured, or mitigated through treatments that include vaccinations, antibiotics, and other basic drugs we take for granted. Hence, during the past year, our focus has been on expanding our preventative, diagnostic, and treatment capabilities. We have established a medical lab and begun diabetes and pregnancy testing, established a partnership with a pharmacy supply company to guarantee the timely delivery of medications, strengthened our preventative efforts with a proactive vaccination program. On my way to Haiti, I read a story entitled The Life of a Haitian. It reflects what I observed during my visit. Most Haitians feel blessed. They go about their daily life rarely complaining. They are happy to have health, a place to sleep, and a meal to eat. In their life, everything has a purpose and nothing is wasted. They have faith that day by day, one small step at a time, their way of life will improve. The longer we were in Cherident, the more we witnessed and felt the determination of the Haitians striving to realize their dream for a better life. For the less fortunate Haitians, it's the holdout hope that somehow tomorrow will be better. For the educated and more fortunate, it's the dedication to giving back. Haitians helping Haitians. As we departed Cherident, I realized that my initial impression of Haiti as an economic and social disaster was mistaken. Poverty and poor health remain far too prevalent, but villages like Cherident and facilities like Clinique Jean Wilfrid Albert are providing Haitians with tangible opportunities to realize their proud dreams. They are providing true hope and possibility.